So what did happen in this mutation? And when your doctor says that we're waiting for these fancy molecular testing on the leukemia, this is what we mean. We're trying to characterize individual AMLs with FISH testing, karyotyping, and next generation sequencing. These are all very fancy tests to look at what types of mutations and genetic characteristics the leukemia has. And this becomes very important because these genetic characteristics will define the subtype of AML. And this is just recently updated last year. And as you can see here, there are many, many different types of mutations and gene abnormalities that gives characteristics to each and different AMLs. And in the bottom here is the different types of subtypes of AML. And to name a few, there will be AML with recurrent genetic abnormality, AML with mutated TP53, AML with myelodysplasia-related gene mutation, AML with myelodysplasia-related cytogenetic abnormality, and AML not otherwise specified. And these are all defined by that genetic characteristics. Also, these genetic characteristics are prognostic. They tell us about how aggressive the leukemia may behave in the future. And broadly, we have three risk categories. These are also updated last year by the European Leukemia Network. And we've categorized them into favorable risk, which is about 35% of all new AML, intermediate risk, which is about 25% of all AML, and adverse risk, about 40% of all AML. And as you can see in the table, these abnormalities are unique and also very complex. So this is an algorithm of how we treat patients with AML, and it's very important to learn this genetic characteristics because it's important in therapy selection. As you can see here, depending on what type of mutations you have, we have all these different therapy options. And also in those who have their leukemia come back, relapse, depending on the mutation status, for example, the FLT3 gene, the IDH gene, we have different types of medications that can target these mutations. These targeted therapies provide individualized treatment plans. And there are some targets in the blue here that are not, you don't necessarily need a mutation and it can be targeted for everyone. Whereas in the red, you need that specific mutation to be present so that we can target with a particular drug. And the goal is that these cancer cells stop dividing and either die or they do their normal thing and grow into an adult cell.